What to do if someone bites you? A bite. It could happen in a split second. You may be in a physical altercation, or maybe there is another reason, but someone bites you. And in that moment, most people have no idea what to do beyond rinsing it off and hoping for the best. But here's the truth. A human or animal bite can be far more dangerous than it looks. Stay with me, because this information could literally save your life. The dangers of a human bite. Let's start with what makes a bite wound so much more dangerous than a typical cut or scrape. The human mouth alone contains over 700 species of bacteria. When teeth break the skin, that bacteria gets driven deep into tissue, far deeper than a surface wound. This creates the perfect environment for a serious infection to develop rapidly, sometimes within hours. One of the biggest threats is cellulitis, a bacterial skin infection that causes redness, warmth, swelling, and pain around the wound. Left untreated, it can spread through the lymph nodes and into the bloodstream. Then there's sepsis, a life-threatening response to infection where the body begins attacking its own tissues. This is a medical emergency that can develop from an untreated bite wound, and it moves fast. Human bites specifically carry the risk of transmitting diseases, including hepatitis B, hepatitis C, and in rare cases, HIV, particularly if the bite breaks the skin and blood is involved on either side. Animal bites bring their own set of dangers. Rabies is the most well-known, a fatal viral disease transmitted through the saliva of infected animals. While rabies is rare in domestic pets, wild animals like raccoons, bats, and foxes are common carriers. If you cannot confirm the vaccination status of the animal that bit you, assume the worst and act accordingly. There's also tetanus to consider, a bacterial infection that affects the nervous system. If your tetanus vaccination isn't current, a bite wound is absolutely a trigger for a booster shot. Immediate steps to take. Here's exactly what to do the moment you've been bitten. Step 1. Control the bleeding. Apply gentle pressure using a clean cloth or sterile gauze. Do not use excessive force. You don't want to drive bacteria deeper into the wound. If bleeding is severe or won't stop after 10 minutes of steady pressure, go to an emergency room immediately. Step 2. Wash the wound thoroughly. This is the single most important thing you can do. Rinse the bite under clean running water for a full 5 minutes. Use mild soap and wash gently around and inside the wound as best you can. Do not scrub aggressively, as this can damage tissue. Step 3. Apply an antiseptic. Once cleaned, apply an over-the-counter antiseptic such as povidone iodine or hydrogen peroxide to help reduce bacterial load. Cover the wound loosely with a clean bandage or sterile dressing. Step 4. Identify the source. If bitten by an animal, try to note its species and appearance without approaching it. For human bites, note the circumstances. This information is critical for medical professionals assessing your infection and disease risk. Step 5. Seek medical attention. Even if the wound looks minor, see a doctor. You may need antibiotics, a tetanus booster, rabies post-exposure treatment, or blood-borne illness screening. Bite wounds are notoriously prone to infection, and a doctor needs to assess the depth, location, and risk factors involved. Step 6. Monitor for infection. In the days following, watch for increasing redness, warmth, swelling, pus, fever, or red streaks spreading from the wound. These are signs of a developing infection that requires urgent care. A bite might seem like a minor injury in the moment, but what's happening beneath the surface is a different story entirely. Act fast, clean thoroughly, and always get a medical professional involved. Don't gamble with something as serious as infection or disease transmission.